So I'm going to teach you parotid gland, and that is going to be really fast. Parotid gland, because I want to teach you facial nerve after that. So I'll be starting from this end and finishing parotid gland by that end. Parotid gland is the largest salivary gland. That does not make it the one which secretes the most, that is submandibular. Predominantly serous, shape of an inverted pyramid, extends between mastoid process and mandible, mastoid process and mandible, but it doesn't lie between them, it grows over them also. तो अगर हम बोल रहे हैं कि mastoid process and mandible, मतलब वो इधर खत्म होना चाहिए ना, it extends on the mandible over to the masseter also, and then starts the parotid duct. This parotid duct pierces the buccinator and opens above the second molar, above the upper second molar, near that it opens the parotid duct. So buccinator serves as a valve, because buccinator pushes the food inside whenever we are eating. So that time the pressure here increases and there is a chance of food going into the parotid duct. That is prevented by buccinator. Now if I take a transverse, now here in this I see a base which is related to external acoustic. So this is base or superior surface related to external auditory meatus. This is apex, and apex is related to the external carotid artery going inside. External carotid artery going inside. The cervical branch of the facial nerve. Cervical branch of the facial nerve. It comes out from here. Now if I take a transverse section, anteriorly this is the mandible. This is the mandible. Currently looking from exterior, we could only see its base or superior surface and apex. Now this is mandible. On the outer side of the mandible, there is a muscle called masseter. On the inner side of the mandible, there is a muscle called medial pterygoid. Pause here. So anteriorly, we are seeing a transverse section at this level, transverse section. Right side ka. So this is mandible, posterior border of mandible. On the lateral side, left side ka. On the lateral side there is masseter. Right in this is lateral, this is medial, this is anterior. And medial side there is medial pterygoid. So mandible ke andar ke side medial pterygoid, outer side masseter. Posteriorly this is the mastoid process. This is the mastoid process, and getting inserted on the mastoid process is one muscle, sternocleidomastoid, and another muscle, that is the posterior belly of digastric. Okay? So this is clear to you? So this is the posterior side, this is the anterior side, this is the lateral side, this is the medial side. Is it clear to you? Okay. Now the parotid gland is like this. हमने discuss किया. It extends over masseter, it extends slightly over the, but then it goes inside. It not only extends on them, it goes inside, between them, inside also. So now we are in a position to identify its anterior border. This is anterior border. This is posterior border. This is posterior border. One border which we could not see here because it was going in. It was going in, and that border is medial border, which is related to the wall of pharynx. If you go deep here, inside is pharynx. Medial border is related to pharynx. Now till now we had only seen one surface, that was the superior surface or base. And this surface was called as superficial surface. So this was called superior surface. This surface was called as superficial surface, which is covered by the investing layer of deep cervical fascia. Rather, investing layer splits to enclose this gland. The inner side, investing layer will split like this: one outer side, one inner side. Inner side separates it from submandibular gland, which is here, and that becomes so thick that it is called stylomandibular ligament. So stylomandibular ligament will be there on the inner side. Now let us identify two more surfaces. Yudhishthir, इधर देखो. हाँ. Let us identify. नहीं, तू छुप रहा है उसके पीछे. This is anteromedial surface and this is posterior-medial surface. दो और surfaces हमारे पास आ गए. अब तक हमने कितने surfaces देखे थे? Superior, superficial. Now anteromedial and posterior. Anteromedial surface is related to posterior border of ramus of mandible, masseter and medial pterygoid. Posterior medial surface is related to mastoid, sternocleidomastoid and posterior belly of digastric, and also the styloid apparatus. I'll tell you what is styloid apparatus some other time. Styloid apparatus. Okay. Now anterior border. Facial nerve which comes out of the stylomastoid foramen and styloid process के वहाँ से stylomastoid foramen and it comes out like this. Passes through the parotid gland. It's the most superficial structure. There are three structures which pass through the parotid gland. One is the facial nerve. Second is retromandibular vein. And third is external carotid artery. Third is external carotid artery. Three structures pass through it. Now I will draw diagrams for these three structures. This parotid. Consider this as anterior, this as posterior. The facial nerve comes like this, enters the parotid, divides into its 5 branches. You know the 5 branches. Okay? Temporal, zygomatic, buccal, marginal mandibular, and cervical. Retromandibular vein comes here, divides into anterior branch and posterior branch. Anterior branch unites with facial to form common facial. Posterior unites with posterior auricular to form external jugular vein. Common facial. W pattern. The W pattern lies in the parotid. An external carotid artery enters here. It has already given 5 branches. Before coming here. 5 branches in carotid triangle and 3 branches in parotid region. And one of them is posterior auricular. superficial temporal and maxillary. And maxillary. Okay, assimilate this. Okay, three structures. What is the most superficial in the parotid? Facial nerve. Then facial nerve. Then retromandibular vein. Then deepest is external. क्या हो गया तुम लोग को सब? नाश्ता नहीं किया? साइकिलिंग का एनर्जी गया खत्म. External carotid artery. Blood supply of this will be by external carotid artery. Nerve supply of parotid. Nerve supply of parotid. Parasympathetic, sympathetic, sensory. Sensory will be by auriculotemporal nerve. Sympathetic will come from the T1, superior cervical ganglion, rather. Parasympathetic. Now this is your first exposure to nerve supply of a gland. ऐसे चार आएंगे इसके बाद. The nucleus which gives parasympathetic supply to this is inferior salivatory nucleus. अगर आपने न्यूरोएनाटॉमी बराबर से पढ़ा है तो आपको इसमें से कुछ याद आएगा. सुपीरियर सलाइवेटरी न्यूक्लियस, इंफीरियर सलाइवेटरी न्यूक्लियस. जबकि मैं आपको न्यूरोएनाटॉमी पढ़ाना चाहता था, लेकिन कुछ लोग जिन्होंने अपोज किया उसके लिए, लीडर्स ने आपके, इसके कारण मैं सिखा नहीं सका. क्योंकि आपको केवल आपकी जिंदगी का उद्देश्य केवल अपर और लोअर लिम्ब था. इसके ऊपर आपको ब्रेन में कुछ भी डालना नहीं था. सब नहीं, एक दूसरे को नहीं, इधर उधर मत देखो. इंफीरियर सलाइवेटरी न्यूक्लियस, इट सेंड्स फाइबर्स वाया ग्लॉसोफैरिंजियल नर्व. Glossopharyngeal nerve. This glossopharyngeal nerve gives a branch called as tympanic branch. Tympanic branch in the middle ear. Tympanic middle ear. This tympanic branch goes to tympanic plexus. Tympanic plexus. From this tympanic plexus arises a nerve. युधिष्ठिर, तो छुप रहा है यार उसके पीछे. मेरा तो दिख नहीं रहा. नहीं. From this tympanic plexus arises a nerve called as lesser petrosal nerve. इसके बारे में युधिष्ठिर कहाँ सुना है तुमने? lesser petrosal nerve. ये नाम है बाबा. तू किसे बोला कि मैं तुमको पूछा? कहाँ पे सुना है? युधिष्ठिर खड़े रहो. लेसर पेट्रोजल नर्व, ये नाम तुमने कहाँ सुना है? बाजू का लड़का नहीं तो तेरे को जो बीच में आ रहे हैं ना वो. हाँ खड़े रहो तुम. हाँ तुम क्या नाम है तुम्हारा? क्या? आयुष. इतना जोर से क्यों चिल्ला? कहाँ पे सुना है लेसर पेट्रोजल नर्व? बाजू वाला बॉम्बे का लड़का. क्या नाम है तुम्हारा? गौतम. स्नेहल. ऊपर तरी नाम. ये लड़की. हाँ चश्मा. क्या नाम है तुम्हारा? कृष्णा. बोलो. foramen ovale structures passing through foramen ovale. MALE. Mandibular nerve, accessory काय होतं ते? And accessory metal meningeal, then lesser petrosal nerve
And
and emissary. So lesser petrosal nerve, this lesser petrosal nerve passes through the foramen ovale, right? Passes through foramen ovale and ends in otic ganglion. Ends in otic ganglion. So this is preganglionic fibers. इतना तो आपको मालूम है ना, इन पैरासिम्पैथेटिक सिस्टम प्री गैंग्लियोनिक फाइबर्स आर लॉन्गर, पोस्ट गैंग्लियोनिक आर शॉर्टर. इन सिंपैथेटिक प्री गैंग्लियोनिक आर शॉर्टर, पोस्ट गैंग्लियोनिक आर longer. And from otic ganglion via auriculotemporal nerve, it reaches parotid gland. पुस्तक कोणी आणलंय? सिंपॅथेटिक सुपिरियर सर्वायकल गँग्लियनच्या असंच लिहिलंय का म्हणतो पॅरोटिड पॅरस अँड सेन्सरीज व्हाया ऑरिक्युलर टेम्पोरल ना. अप्लाइड anatomy, the swelling of parotid gland is called as बरोबर आहे का? काय लिहिलंय ते नाही, सिंपॅथेटिक विचारतो. काय? प्लेक्सिस अराउंड, हो पण ते कुठून येतात असं लिहिलं नाही तिथे. प्लेक्सिस अराउंड मिडल मेनिंजियल आर्टरी एवढंच लिहिलं. ओके. अँड मोस्ट इम्पॉर्टंट ड्युरिंग during surgeries of parotidectomy छोड़ो, during surgeries of parotid, you have to operate in two planes, one superficial to facial nerve and deep to facial nerve. Because facial nerve है अपन जो absent लोग हैं ना, जो रफ facial parotid का टिश्यू निकाले क्या कर रहे हो डॉक्टर साहब? वो सारे फेशियल नर्व्स में से जाता है पैरोटिड ग्लैंड में से. ओके. जो वो उधर पूरा भाजेकर एब्सेंट है आज. भाजेकर बैठता है उधर, मेरे को मालूम है. कितने लोग हैं भाजेकर से आज? टोटल हॉस्टल का स्ट्रेंथ कितना है? 50 है ना ऑलमोस्ट. हाँ 70. और इधर लिख रहे मेरे को 20-30. ओके ठीक है, थैंक यू. बंद करो.